Turning to the medical dispute, the majority of trainee doctors in the country have yet to return to their work sites, past the deadline for acceptance of their resignation letters delivered earlier, leaving hospitals struggling to process these en masse. Hye-ryeon explains.
A day after the deadline for hospitals to begin processing their resignations passed, trainee doctors are remaining resolute in their decision not to return to work to protest the government's medical reform. Data from the government and medical organizations showed on Tuesday that out of 13,756 trainee doctors nationwide, only between 40 to 50 interns and residents had returned to work by Monday. Only 7 out of 520 trainee doctors at the country's Big Five hospitals, including Seoul National University and Severance hospitals, had reported for duty, with Korea University's Anam hospital stating that only 1 trainee doctor had returned to work. The government previously said that resignation forms would start to be automatically processed if the doctors did not state their intention to return, prompting concerns that mass resignations would be inevitable. Many hospitals are currently waiting for responses and are putting processing on hold for the time being. The olive branch extended by the government in an attempt to end the prolonged walkout has been met with a lukewarm response from trainee doctors so far. Speaking at a plenary session, the country's health minister admitted that there could be more resigning than those returning to work, and spoke of planning more concrete policies to persuade them to resume their training in September. Last week, the government withdrew punitive measures against trainee doctors defying return-to-work orders and promised special benefits to those who reapply to training hospitals later this year. Meanwhile, a briefing from the Central Disaster and Safety Countermeasures Headquarters stressed that medical reform cannot be delayed, and the doctors should give it a chance instead of taking collective action even before its implementation. Hospitals are also due to submit the number of trainee doctor slots available for recruits in the second half of the year to the Ministry of Health and Welfare by Wednesday. Hye-ryeon, Arirang News.